Hi, everybody. It is Sunday, February 18th. I'm a little bit late with this update. I was supposed to do an update on Friday, but the past couple of days have been an absolute whirlwind. I think the last time I talked to you all was um, the day was Wednesday because it was the day before I was supposed to go back to work. Um, so I did go back to work on Thursday. I am working remotely, and it was actually a very sad day because if you recall from the last video, my company had done a layoff of 800 people, some of whom I work with every day. So it was very sad. But I got through the day okay. And then Friday, I had my visit with the oncologist to find out what my protocol is going to be. And thankfully, a friend went with me. And so that's what a majority of this video is going to be about. I'm going to let you all know what are next steps for me and a little bit about how I'm feeling about it. So here we go. As I mentioned before, I definitely will be having chemotherapy, and the reason for that, even though they removed the tumor, the cancer was so aggressive. If you recall, my Ki-67 was 50 to 60%, and my HER2 wound up being positive. So for those two reasons, I definitely have to have chemotherapy, and that's just to make sure that no random rogue cell has broken off and is floating through my body. Having the tumor removed, the margins were clear and the lymph nodes were clear. So that's all really positive news. But because my Ki-67 is so high and it's HER2 positive, I definitely have to have chemo followed by radiation. So here we go. I have my notes here that I took from the doctor's office. So I'm going to be referring to those notes. So the chemo will be administered through IV. So they'll be putting a port in my chest to administer it. I will be getting 6 cycles of chemotherapy. That's 1 treatment every 21 days. So that comes out to about 5 months worth of chemo. While they're giving me chemo, they're also going to be giving me some HER2 blockers. And even once the chemo is over, I'll continue with those HER2 blockers for a year. So I'm going to have the port in my chest for the next year. Yikes. As of right now, the chemo drugs that I'll be getting is Taxotere and carboplatin. So I wrote all of this down. Then, of course, as soon as I got home, I ran to Google. And the first one I looked up is the Taxotere. And the first thing that I see is that there is an active lawsuit on Taxotere because people are saying that they're getting permanent hair loss and their tear ducts are getting blocked. So I will be asking my oncologist about that and what he feels about that, and if there's another option for me besides the Taxotere. The carboplatin seems like your run-of-the-mill chemo. And then for the HER2 blockers, I'll be getting 2 of those. I'll be getting Herceptin and Perjeta. And From what I read, I understand exactly why I'm getting those, because those two drugs actually give a 1-2 punch to the HER2 um, proteins in me. So they hit at different phases. So they hit the same, they hit the HER2 from two different directions. So I get it. And with me being HER2 positive, that means that it reproduces really, really fast. So they've got to hit it hard. And that's probably why I'm going to be getting it for a year, because they just have to make sure, because it duplicates so quickly, they have to make sure that they get it all. Um, when I so the Herceptin and Perjeta are considered maintenance treatments once the chemo is done, and I'll get that once a week, every 3 weeks for a year. So now let's talk about the side effects that I can expect. So number one is going to be fatigue, nausea, and what they told me is that prior to putting the chemo in the IV, they're going to give me an anti-nausea medication, and then I'll also get two different types of anti-nausea pills that I can take at home. Actually, I picked them up from CVS yesterday. So that one of my biggest concerns with this is the nausea. So it concerns me that I'm going to be getting an intravenous anti-nausea and then still two pills on top of that. So I'm hoping that the nausea doesn't become a big thing in my treatment, but I have the pills here just in case. There's a good chance that I'll have diarrhea. There's a good chance that my nails will turn dark. And then I will lose my hair. And yeah, when I look at all of the four drugs, I can see why they say I'm going to lose my hair. The two chemo drugs absolutely will have me losing my hair. And then I can't remember which. So again, this is my regular disclaimer. Don't take everything that I'm saying as gospel, because I'm still in the learning phase of what all of this stuff is. So some of the stuff that I say might be a little bit off. But if I remember correctly, the Perjeta really doesn't mess with your hair at all. The Herceptin, I believe, is the one that will cause your hair to thin out. So if I'm on chemo and I'm going to be losing my hair and I'm going to be taking the Herceptin, I'm just assuming that that is going to maybe delay my hair growing back, or it won't grow back at the same rate or the same thickness. I don't know. I'm just expecting for the next year to have little to no hair. But that's why there's wigs. So well, what I'm hoping is that my head is not funny shaped and that I maybe look good bald. And if I do, I'll rock that. I'll put on some false lashes and rock my bald head. And if not, I'll throw on a wig. It is what it is. Throw on some false eyelashes in case I lose my eyelashes. Draw on some eyebrows in case I lose my eyebrows. So yeah, that'll be good. There's a good chance that I'm going to gain weight. And if you know me personally, you know I've been on a weight loss journey. Still got a ways to go, but I've made some headway. But I will most likely gain some weight because I'll be on steroids. The other thing that the doctor told me, and this is probably my number one concern out of everything, the chemo drugs that I'll be taking are pretty rough, and they're rough on your heart. So this coming week, I have to go to get an EKG to make sure that my heart is strong enough to handle these drugs, and my heart will be monitored throughout the whole process. So I'm really concerned because I have read where it does do heart damage. The other thing is my white blood count can drop really low, so they'll be monitoring that. If it does drop low, they have a shot for that, but then that shot causes bone pain. So if I get the bone pain, then there's something else that they can give me. You know how it is. They give you one medicine to fix you, but then the side effects cause something else, so they're giving you, drug after drug. But that's what I'm looking at. It is what it is. I did ask the doctor, looking at my situation in its totality, what do you see as the good and what do you see as the not so good? And what he told me is that the good is this is absolutely curable, and it's curable because we have the treatments. He said 20 years ago, it wasn't as targeted. They just kind of threw the chemo at patients, and it was like one chemo for all, but now they have different types of chemo medicines depending on the patient's particular situation. So that was good to hear. He said the bad is what I already knew from my own research, and that is I am HER2 positive, and that my Ki-67 number is so high. And I talked about that a little bit in a previous video. He did say without treatment, there's a high probability that this will come back. So I really don't have too much of a choice. So I'm just going to hold on tight and go for this ride. Now, I have to tell you that I was very weepy, to put it mildly, during this visit. This is really hard to face, that this is happening. But slowly but surely, as the days go on, I'm finding myself again. I'm getting the woe is me out of my system, and I'm getting back to my regular strong self so that I can prepare for this. I have also, as far as the hair situation goes, emotionally, seeing your hair fall out in clumps can kind of mess with you. So I have decided that once I see my hair starting to fall out, I'm just going to get it all shaved off. And the nurse that I spoke with said that it's probably going to start to fall out between the first and second cycle. So I'm guessing like between week 2 and week 3, it will start to fall out. So I'll be shaving my head. I did have a friend go to this appointment with me, and you know who you are. Thank you so very much. I really needed that support. And the doctor was very good at speaking with me and speaking with her. After we met with the doctor, he took us to the infusion room, and that's the room where they do the chemotherapy infusion. And there were 3 nurses in there. So we met all 3 nurses, and then one of the nurses went over what I can expect. Actually, gave me a lot of stuff. So I got this, a guide to your treatment. I got this, things to look for. They gave me lots and lots of paperwork. So what to eat, what to do after my chemotherapy session, and then all of these different, there's a couple of them, all of these different papers that actually tells me about each of the um, drugs that will be infused in me. So I have the Perjeta, I have the Herceptin, the Carboblastin, and the Doxatel. Doxatel. And then this one, I don't know what this is. GCSF filgrastim injection. Oh, it lowers the risk of infection in people who are receiving chemotherapy. Works by helping your body make more white blood cells. Okay, so they did tell me about this. So, like, as you can imagine, the chemo is going to kind of kill off the white blood cells. So this is going to help restore my white blood cells. So I'm going to be reading this in a little bit more. I just, it was just too much. I just couldn't. But now I'm starting to come to grips with this. So I'm getting my strength back, and so I'm gonna read into this a whole lot more. I want to mention something about my oncologist, because in a previous video I was telling you guys I wasn't really sure about him, but I was gonna, go to another appointment with him and see how he was and see how I felt. I am absolutely comfortable with this doctor. The friend who went to the appointment with me, she was just a few minutes late, so the doctor and I had started. And when she came in the room, he didn't just pick up and continue where he had left off. He actually went back and got her up to speed. And he was I just felt that he was the right combination of giving me what I needed. And what I mean by that is he was compassionate, he was honest, and he was thorough. So he said things like, this is going to be a tough road, but it's doable. I know this is scary, but you can make it. So it was that kind of thing. Like, I don't like to be sugar-coated. I want to know, what can I expect? So that's when he was like, it's going to be a rough road. But he also said that this is curable. Now, of course, nothing is 100%. But by me taking this regimen that he's decided for me, I really, really up my chances of keeping this very aggressive cancer from coming back. Again, no guarantee that it won't come back, but my chances are better that it won't come back. I had mentioned to you all before that one of the benefits through my job is second MD, where I can get a second opinion. So that is currently being scheduled. So I assume that it will happen this coming week or maybe the following week. And I just kind of want to run past the protocol, the drugs that were selected for me with the second MD doctor. So we'll see what they say. But I'm getting there, you all. I'm getting there. The next 5 months are going to be very, very difficult. So if you all are prayer warriors, please pray for me. Yeah. Okay. Yeah. Please pray for me. So this coming week, I don't know if I mentioned this coming week, I'm going to get the port put in. They're going to do the EKG, make sure that my heart can handle what's about to happen. And then the following week, I'll actually start the chemo. Of course, I'll come back and do an updated video. My plan is to, at least for this first cycle, is to do just like a little quick blog every day about how I'm feeling. Like if I'm feeling good, or if the nausea sets in, or whatever is happening, just to get that documented. I want to get that documented. And then each round of chemo, I'll do the same thing, because from what I hear, that it cumulatively gets worse. So as your treatments go on, the side effects become more pronounced. So I'm going to be documenting that as well. One thing I have to say that makes me very sad, and there's just no way around it, is how this has already impacted my life. There were 3 projects that I was supposed to work on that I had to let all 3 of them go, because I just am not sure that I'll be up to giving these producers what they need. So that's very sad. The other thing that makes me very sad is that I was part of a committee of studios in LA, tech companies, and social media companies here in the LA area. We were planning a sneaker ball for the end of February, and I had been very, very active in the committee for that for the past couple of months. And the sneaker ball is this coming Saturday, and I don't think that I should be going, because I'm going to be considered immunocompromised, which means like I will be more receptive to getting sick, because my immune system is going to be in a pretty bad state. And even though the sneaker ball is before I get my first chemo treatment, I don't need to be out with 250 people and catch a cold or COVID or flu or anything like that days before I start chemo. So I'm sadly, very sadly, going to miss the sneaker ball. I'm so sad about that. I've been working on this thing for months and months and months, and now I can't even participate in it. So that's really sad. But I have to put my health first. And I think I had mentioned in a previous video that I'm going to do a separate video on diet and food and all of that stuff. I spoke with the nutritionist the other day, but then I also spoke with the doctor and the nurse on Friday, and they gave me even more specific things, foods to avoid while taking chemo. So I'll do a separate video on all of that stuff. So I think I'm going to end it here. I'll check back in. Right now, my doctor is getting, where's the paper? My doctor is getting approval from my insurance. I have no idea what these things mean, but I'll give it to you anyway in case you want to look it up. So he has orders that need approval for a PTT, a CMP, a PTINR, and CBC with differential 3-part. I know that is a blood count thing. So they want to see where my blood count is now so that they can monitor it. And I know that I have to get an EKG and, you know, all of that stuff. So all of that will be coming up this week. So once I have those appointments, I will check back in, and then I'll check back in again. I think I'm going to check in the day of my first chemo treatment, because I want to document how I'm feeling right before my first one. And then I don't know if I'll be able to, I'll see, because the The infusion room, they have like all of these chairs around, comfortable chairs, and then they have curtains so you can have privacy. So I'll see. I'm not sure if I'm going to be allowed to document in there, but if I can, I'll document them putting the chemo into the port so you all know, because like one of my questions was like, what does this look like, what can I expect? So anybody that's getting ready to go through chemo, I want to be able to document that for you, keeping in mind that everybody's journey is different, but it'll kind of start to give you a frame of reference. So I'll be doing that. So anyway, I'm going to end it here. I hope you all are having a wonderful day, and stay strong. Keep a smile on your face. Keep your friends and your loved ones very close. They're very important in this journey. And I thank all of my friends and my family who have been there for me. Love you all. Take care. Bye.